This short video will demonstrate how to install the Pedimate Plus harness for safely securing children between 4.5 and 45 kilos to the Ferno ICU transfer trolley. Young children below 10 kilos will require the use of the paediatric ventilator tubing on the Hamilton ventilator. Setup and checking of this circuit is also demonstrated. The accompanying video details the full setup and use of the transfer trolley, along with further instructions on setting up the ventilator for all sizes of patient. Firstly, adjust the adult harness as shown to avoid getting in the way of the paediatric harness. Cover the stowed harness with a sheet. Undo the velcro straps and unroll the harness. Raise the head of the trolley to around 30 degrees to allow access to the underside for securing. 3 straps buckle the harness to the body of the trolley. Make sure the pneumatic struts are avoided as shown. The lower buckle is a bit more fiddly as the bariatric side supports need to be pulled out to access the bar that the belt secures around. Do the same on the other side. The third strap is grey and secures the child chest straps directly to the trolley. Again, avoid the pneumatic struts when buckling this on. Once the 3 straps have been buckled on, take some time to arrange the harness straps as Mike deftly demonstrates. Firstly, Mike's going to demonstrate strapping a child into the harness. After lifting the child into position, the straps are applied over the shoulders and the 2 shoulder straps held together as shown. Each side is then buckled into the crotch strap and tightened as Mike carefully shows. The black strap is now applied around the child's chest, beneath the grey shoulder straps. Mike could have chosen to do this first. Now a baby is being shown secured. The steps are repeated as for the child. The Hamilton ventilator is capable of ventilating a child down to premature baby size. If the child you need to transfer is below 10 kilograms in weight, you'll need to use the paediatric tubing. You won't need the pressure line for nasal CPAP, so you can discard this. Remove and discard the protective cover. Make sure the diaphragm is well seated and rotate the expiratory valve onto the ventilator outlet until it clicks into position. The inspiratory limb just pushes into position. The pressure and flow monitoring tubing is colour-coded, pushing onto the colour-matched nipples on the machine. Finally, the tubes are attached to the patient end before adding a paediatric HME and CO2 sensor. Next, the ventilator is turned on and calibrated. The ventilator will recognise that a paediatric circuit has been installed and will therefore show wrong expiratory valve until you switch to the neonatal presets as shown. Children above 10 kilograms can be ventilated with an adult circuit, and so select the adult/paediatric tab in this case. Here, Mike has initiated the leak test. Next, the flow sensors are calibrated. The machine requires the sensor to be disconnected and turned back to front using the included adapter as part of the test, as Mike nicely shows. This takes a bit of time, so has been sped up. The pressure sensor is swapped back to its usual position to complete the test. Lastly, the oxygen sensor is checked. This also takes a bit of time, so has been sped up. The ventilator is now calibrated and ready for use. At setup, the neonatal setting should be chosen, and a number of default weights are pre-inputted for children of 2, 5 and 8 kilos in a pressure control mode. These can be modified to match the child's weight. You can see in these pictures that the machine has recognised that an adult circuit is attached and displayed a warning. To see a detailed setup of the complete Ferno Transfer trolley and Hamilton ventilator, see the accompanying video.